All right, let's take some time to look at the muscles of mastication. I call these the time muscles, T-I-M-E. The T would be for temporalis. The I would be for the internal pterygoid, which is another way of saying medial pterygoid, right? Internal is medial. The E is external pterygoid, which is the same as saying lateral pterygoid. And then the M is for masseter. So you have T, I, M, E. Temporalis, internal pterygoid, masseter, and external pterygoid. Again, medial is interchangeable with the term internal, and lateral is interchangeable for the E and external. These are the chewing muscles. You'll see that the lateral pterygoid kind of runs in alignment with the maxilla, and it does have insertion here on that condyle, the mandibular condyle. In order to see the medial pterygoid, you have to cut away a bit of the mandible to see its attachment at that angle of the mandible. And both of these pterygoids are going to originate on those pterygoid processes, which, if you remember from osteology, are on the underneath surface, just posterior to the hard palate. Here's your temporalis and masseter. So let's not confuse masseter, if you look at the direction of these fibers, with the internal or medial pterygoid. The masseter is superficial to the mandible, whereas the medial pterygoid is deep and on the inside. So which structure is highlighted here? This would be the temporalis. What is the origin of the highlighted muscle? So the insertion is here, which is on the coronoid process of the mandible. Don't confuse coronoid with the term coracoid, but the origin is here on the temporal bone, on the fossa of the temporal bone. What is the insertion of the temporalis? Well, I think I gave it away before. It's the coronoid process and a little bit of the ramus of the mandible. Okay, now this one, remember, if it's superficial and outside of that angle of the mandible, it's the masseter. If you see the angle of the mandible cut away so you can see what's deep, then we're looking at the medial or internal pterygoid. Okay, now this one is the trumpet blowing muscle. This is called the Bukinator or the Bukinator. And if you remember, buccal means cheek from the very beginning of anatomy and physiology. So if you were to do this and puff out your cheeks, that's the Bukinator's job to do that. Now here we see the mandible is cut, and you can see these horizontal fibers. Which muscle is this? This would be the lateral pterygoid. When I treat patients that have TMJ, I have to insert my finger through their mouth and reach all the way back, with the glove on, of course, all the way to the behind that last molar in order to treat the insertion of the lateral pterygoid. And that's one of the triggers to TMJ dysfunction, temporal mandibular joint dysfunction, is if that muscle's in spasm, the pterygoids deviate the jaw side to side, right? The temporalis chews up and down like this, but when you chew, you just don't chew up and down. Your jaw can deviate side to side. Now this one, on the other hand, this one we can see the medial or internal pterygoid because you can see the mandible cut, and these are going down.